Hello, my name's Autumn, and we're going to talk about Parkinson's disease. Parkinson's disease is a neurological disorder. It is also a progressive disorder, which means that it gets worse over time. It affects the nerve cells in the basal ganglia and the substantia nigra. The nerve cells in the substantia nigra produce dopamine, which is a neurotransmitter that's required for sending messages that control body movement. In some people, the dopamine producing nerve cells start dying off. So once 80% of the dopamine is gone, then they start experiencing some Parkinson's symptoms, such as tremor. Body movement is controlled by a group of nerve cells called ganglia, and information comes to the striatum, and then the striatum works with the substantia nigra to send messages to the spinal cord and to the brain, to and from both. The basal ganglia and cerebellum make sure that the movement is smooth and fluid and looking good and normal. The impulses go from neuron to the spinal cord and then to the muscles. Every once in a while, dopamine receptors aren't stimulated properly, resulting in the basal ganglia being over or understimulated. To be more specific, the subthalamic nucleus becomes overactive and stops the globus pallidus interna, or the GPI, and this causes a shutdown of movement. If the GPI is overstimulated, it affects the thalamus, causing a decrease in output, also resulting in a tremor. So that's often the first symptom of Parkinson's disease. Some other symptoms of Parkinson's disease include rigidity, which is stiffness in the limbs or in the torso, bradykinesia, which is just slow movement, inability to remain steady, or walking difficulty. So sometimes people with Parkinson's will look like they're almost shuffling. Dystonia, which is a body movement disorder where the body will get stuck in a certain position. Changes in voice, such as pitch or volume, or sometimes they can develop a stutter. Some other symptoms include loss of sense of smell, struggle with staying or falling asleep, pain, and surprisingly, more than half of Parkinson's patients experience psychosis. So that means delusions or hallucinations. They also experience fatigue, cognitive changes such as slower thinking, weight loss, gastrointestinal issues such as constipation, urinary difficulties such as going to the bathroom a lot more frequently, and lightheadedness. Also, a decrease in libido, excessive sweating. They have an increased risk of melanoma. They have personality changes, and also slow blinking. The diagnosis process is a little bit complicated because there's no specific test to diagnose Parkinson's. So somebody who thinks they may have Parkinson's would go to the doctor, go to a neurologist, and the neurologist would do some exams. They would provide other tests to rule out other diseases, and then based on their symptoms and the neurological exam, they would come to the end result being Parkinson's. Treatments they're different for different patients because they just treat symptoms. There's no cure for Parkinson's. So they mostly include medication to suppress symptoms. Sometimes they'll use surgical therapy. And then other times it's as simple as more rest or more exercise. The people who are at higher risk for Parkinson's disease are people who are getting older. The average age for onset Parkinson's is 60 years old. Men are actually more likely to get Parkinson's than women. Genetics also play a really big role, so that means that if someone close to you in your family, like a parent or a brother, has Parkinson's, then you do have a higher risk of developing Parkinson's with age. Other people at high risk are people who have been exposed to farming chemicals for a long time. And then we've also found a link between multiple blows to the head and an increased risk of developing Parkinson's. So many concussions or hits to the head will increase your risk of getting Parkinson's disease. That's all I have for you. Thank you.